Start with the pharynx. So we've got 3 parts to the pharynx. Come straight back from the nose. You're in the nasopharynx. Come straight back from the mouth. Oropharynx. This is the larynx, which we'll do next. So go above the larynx, you're in the laryngopharynx. So when you breathe in through your nose, nasopharynx, oropharynx, laryngopharynx, then you're gonna go through the larynx, trachea, lungs. When you breathe in through your mouth, oropharynx, laryngopharynx, larynx, trachea, lungs. When you eat in through your mouth, oropharynx, this is going to flap down, called the epiglottis, which we'll talk about in a minute, so that food and liquid are forced posteriorly into the esophagus, then into the stomach. Okay, so then the larynx. So this is the larynx right here. This is also the larynx. And so is that big one right there. Okay, so let's start with the big one. Okay. And there's not one perfect model, so we're gonna have to look at a couple of them. Okay, so the most anterior part of the larynx right here is called the thyroid cartilage. On here, this is the thyroid cartilage. On here, there's a white piece of tape over it, thyroid cartilage. I'll turn it around in just a second. Thyroid cartilage. That's your Adam's apple. So males just have a thicker thyroid cartilage than females, okay? But everybody has a thyroid cartilage. Then the most inferior part of the larynx is cricoid cartilage. So on here, cricoid cartilage is the most inferior part of the larynx, and it goes all the way around the back, cricoid. And then on this one, cricoid cartilage, the most inferior part. Okay. Then posteriorly, you can't really see it on here. They would sit like right about here, but you can't see them on this model. On here, you can't really see them either. They would sit like around here, but where you can see them nicely is on the posterior side of this model. So I'm gonna set this down. These guys right here, those are your arytenoids. So those are cartilages also, arytenoids. Then the part that flaps down is the epiglottis. That's this part right here that sticks up. When you swallow, that would flap down, so that food and liquid are forced into the esophagus and not into the larynx. So epiglottis here, this is the epiglottis. So it's always, it shouldn't be down like that, but it would be like this, and then it should flap down like that. So epiglottis, and then on here, that's the epiglottis, part that sticks up. Okay, then when you look inside the larynx, that's where you see the vocal cords are inside. These are totally destroyed in here, so we're going to use this one. So I'm going to kind of show this around like this. The white ones, the ones that you see most medially to the little opening, are the true vocal cords. So you're going to see a hole. Okay, let me just show it first. So you're going to see a hole is the glottis. That's where the air is going to go through. And then you see the white bands on either side of that hole. Those are the true vocal cords. Then you see the red bands lateral to those. Those are the false vocal cords, also called the ventricular folds, also called the vestibular folds. The true vocal cords, the white ones, are the ones that vibrate and allow for sound. The false vocal cords, the red ones, also the ventricular or the vestibular folds, they work with the epiglottis to close the glottis so that food and liquid can't get through here and are forced into the esophagus.
And you said those are inside of that
so it goes glottis, the whole, true vocal cords, and then lateral false vocal cords. Okay, so white, true, red, false in here. Okay. Thank you, the model opens up, yeah, that would help.
Oh, no.
Model opens up. So, most medially, true vocal cords, more lateral, false vocal cords.
That's the vestibular.
Yeah, vestibular. Okay. So then you have the hyoid bone. Hyoid bone is this guy right here, hyoid bone. On here, hyoid bone, right there. And then we're ready to do the trachea. So on here, this is the trachea. So below the cricoid cartilage is trachea. On here, trachea. I don't like the way I'm doing that. That seems perverted. Stop doing that. Trachea. Okay, so then we've got lungs. Okay, so look at this. So again, trachea, end of the trachea. The trachea are going to branch into your primary bronchi. You've got a left primary bronchi that takes you into the left lung, and then a right primary bronchi. So, right primary bronchi. Thank you. Right primary bronchi takes you into the right lung. The right lung is bigger than the left lung. The right lung has 3 lobes to it. So a superior lobe, a middle lobe, an inferior lobe. You've got fissures that divide everything. The oblique fissure separates the inferior from the others, and then the horizontal fissure separates the superior and the middle. The left lung doesn't have a middle lobe. The left lung doesn't have a horizontal fissure. It just has a superior, an oblique, and an inferior. Okay. The top part of the lung is called the apex. The bottom part of the lung is the base. And on the left lung, so if you look here, the left lung, where the heart sits over here against the left lung, that little divot right there is called the cardiac notch. Okay, so it's only on the left side, and that's where the heart sits left to midline. It kind of pushes over into the lung, and that little divot is the cardiac notch. Okay, and that's it. And then just know your graph and your volumes, like we talked about in lecture.